And that's why when you take out implants, which is sitting here on the table, you'll find similar patients across a broad spectrum that have very similar symptoms. And that's why I think if you sit in front of a practitioner and you rattle off all the symptoms, which, I mean, it's a pretty long list, it's confusing.
Right.
And then you may get tagged with an autoimmune diagnosis. You may get tagged with anxiety or depression.
Menopause.
Fibromyalgia, Sjogren, whatever. I mean, there's just like everything possible. And if you don't have that red swollen breast, somebody thinks it's a breast implant infection. Sometimes they don't even tell their practitioners they have implants.
Right.
So it's it's a little hard, I think. And if it wasn't for this patient or my history of dealing with cancer patients and implant problems, I probably wouldn't be as curious about that. And then that patient clearly put me on a Facebook group, and then I just had people start calling me about explant surgery. So it's taken 7 years and a lot of reverse engineering to work out many of the problems. But when you have chronic inflammation, it can affect every system. So you may have brain fog and light sensitivity and sound sensitivity and dry eyes and a cough and nasal congestion and difficulty swallowing and shortness of breath and chest tightness, pressure, a racing